Welcome to the Applied Physiology Lab at Louisiana Tech University. Today we're going to go over the 7-site skin fold and 3-site skin fold procedure that you would find in the ACSM guidelines manual. So this year it has the 10th edition. Make sure you always have the new edition if you are going to be watching this at a later point in time. One of the first things that you want to do is make sure that your skin fold caliper, and this one in particular is a LANGE SKINFOLD CALIPER. This has been utilized in research for a number of years. And you can actually see the name LANGE SKINFOLD CALIPER here on the dial. You want to make sure that your piece of equipment is calibrated. You calibrate it by utilizing the Calibration Tool. And so you can see here when I use the SKINFOLD caliper and put it on that tool, it'll say 10 millimeters, 20 millimeters, 30 millimeters, 40 millimeters, and then ultimately 50 millimeters. So this is how you would calibrate it. If for some reason you have a SKINFOLD caliper that might be old, you can already see that it's off by 2, and we can verify that by using the tool again, and you can see that instead of it reading 10, it now on this one's reading 14. So we wouldn't want to use this piece of equipment in a lab or in a research setting. Now, if you come over to our lab manual, Victoria is going to read the procedures.
So first of all measurements should be made on the right side of the body with the subject standing upright. The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold and halfway between the crest and the base of the fold. Pinch should be maintained while reading the caliper. Wait 1 to 2 seconds before reading the caliper. Take duplicate measures at each site and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through measurement sites or allow time for skin to regain normal texture and thickness. For example, if you're doing a 7-site skin fold like we do in our 400 level classes at Louisiana Tech University, make sure you start with skin fold site 1, go through all 7, then back to 1. If you're doing a 3-site skin fold, start at 1, go through all 3, and go back to 1 like we do in our 200 level classes in the Department of Kinesiology.
Now, if you are going to do a research study, you would actually want to use a Gulick measuring tape to make sure that you have the site accurately. However, in our labs, in our classes, that may not be the case. So today I'm not going to use this. I'm going to show you how to use your hands to help measure where you would look for the particular site. So with our first site, Victoria is going to read the information, and I'm going to then demonstrate where that site is going to be measured.
Our first site is the abdominal site. It is a vertical fold, 2 centimeters to the right side of the umbilicus.
So essentially that is 1 inch, because 1 centimeter is 2.5 centimeters. So now I would palpate the skin a couple of times to tell the difference between adipose tissue and lean muscle mass. Once I have done that and felt comfortable with it, I would take my skin fold caliper at the base of that, or in between the base and the top, and I would go 1001, 1002, and I see 25. And then I would take it away. Go to the next one, please.
The next site is the tricep site. It is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon processes, with the arm held freely to the side of the body.
So now in a class or lab setting, I use my hands because most people would have symmetrical hands. You would hold this in your right hand. So those of you who are left-handed, you're going to have to learn how to use it in your right hand. So always hold on to your caliper. I put my pinky on the acromion and the olecranon process. I bring my thumbs together, and that basically is the site that I want to measure. So I go 1 centimeter above it. I palpate the tissue. If for whatever reason I can't tell the difference between the lean muscle mass and the body fat, I would ask the subject to contract their tricep. Once they do that, I can palpate and feel the muscle and the skin and adipose tissue. Go ahead and relax. Now I grab that skin fold, go 1 centimeter below it, 1001, 1002, and I get a 15, and then I take it away. Always holding on to that site.
Our next site is the chest site. It's a diagonal fold, 1/2 the distance between the anterior axillary line and the nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women.
So now what I do is not use my fingers because the fingers might be sometimes inappropriate. So I'm going to use my fingers bent so that I'm going to go between the two marks, landmarks, and go in the midline of it. So again, I'm going to palpate that area. If I can't, again, tell the difference, I would ask that person to contract their pectoralis major, relax, and I'll take that tissue at a diagonal skin fold, and then I will come here at 1001, 1002, and I get a 16, and I take it away. If I was going to do this for a woman, she would be asked to have a sports bra. Instead of it going half the distance, it would be 1/3 the distance. So now if I use my 4 fingers, I would go where my ring finger is, palpate the tissue here. Again, if there was a female, if I wasn't able to tell the difference, ask her to contract her pectoralis major, and then ultimately grab that tissue, go at the midline or base, or between the base and the apex, 1001, 1002, and on that one I got a 14.
Our next site is the medial calf. For this, we'll need to put your leg on a chair. It's a vertical fold at the maximum circumference of the calf on the midline of its medial border.
So again, I'm going to palpate it a couple times to tell the difference between the tissue. Come in 1 centimeter below, 1001, 1002, and I get a reading of 8 millimeters.
Okay. Our next site is the mid-axillary. It is a vertical fold on the mid-axillary line of the level of the xiphoid process of the sternum. An alternate method is a horizontal fold taken at the level of the xiphoid sternal border on the mid-axillary line.
So one of the things that I like to do in a class setting to make sure that the arm is cleared is I ask them to put their arm on top of my shoulder. I ask them if they're ticklish, because if they're ticklish and you drag your finger along their body, they might feel a little bit uncomfortable. But again, the xiphoid process coming all the way across, you have a vertical line that would intersect, and from here, again, I would palpate. Once I find the tissue, 1001, 1002, and I get a 19. I take that away while still holding onto the tissue.
Our next site is the subscapular site. It is a diagonal fold, 1 to 2 centimeters below the inferior angle of the scapula.
If for some reason, as I palpate the posterior shoulder at the scapula, I could ask the subject to bend their arm and put it behind their back, so now I can feel or palpate that angle, ask them to relax their arm. Once I've done that, I come right below that at the 1 centimeter below at a 45-degree angle, take that skin fold measurement, 1001, 1002, and I get a 16.
Okay. Our next site is the suprailiac. It is a diagonal fold in line with the natural angle of the iliac crest, taken at the anterior axillary line, immediately superior to the iliac crest.
So now what I like to do is get into a position where I'm in the best location. I generally will ask the subject, please touch your iliac crest. So now they know where it is, they know where I should be touching. So now I use my thumb to palpate that area, come the 1 centimeter above at a diagonal fold, put my caliper on the tissue, 1001, 1002, and I get a 13.
Our last skin fold site is the thigh. It is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease, hip.
So if a person is wearing shorts, which would be most appropriate, you would ask them to pull their shorts up, give them an idea of where you're going to measure. Again, I'm going to use my fingers to palpate and find the landmarks, find the place which will be in the midline of my fingers, so that now I can palpate the thigh. If for whatever reason I can't tell the difference between the adipose tissue and the lean muscle mass, I would ask them to contract their quadricep. Once they relax, palpate that area, make sure I get it, 1001, 1002, and I get a 15. If somebody, for example, shaves their legs and has some type of lotion on their skin, it's going to be challenging because your hands are going to slip, the calipers might slip. If somebody's wearing pants or spandex of something of that nature, what you should do is measure the thickness of that clothing. And for example, this would be 1 millimeter. Any value that I would get from a thigh measurement, I would subtract that 1 millimeter from the value that I got. Now, once I would go through all of those sites, if something wasn't within the 1 or 2 millimeters, as was earlier stated, I would come back and do that a third time, because we would do each of these 2 times to make sure that we have the average of the 2. And again, if they weren't within 1 to 2 millimeters, take it a third time, and then use the average of the 2 that are closest, so that you can use that for your body density equation. So now we're going to talk about that.
So now in this book you have your body density equations for 7-site and 3-site for men and women. Please note that the sites are different for the men and for the women. From there, you can use the Siri equation that was published in 1961. This will estimate your body fat percentage.
And then, if for some reason you have a subject population that is not the same population that was used in that Siri equation, then you have population-specific formulas where you can insert the body density value for African American, American Indians, all the way down to children, those that are involved in sports as athletics, or in the clinical population. We hope this has helped you and learn how to perform the skin fold measurements properly. We hope that you will utilize the equations to help estimate percent body fat, but I will also say that you can certainly use bioelectrical impedance devices. There are some that you can hold with your hands. There are some that you can stand on with your feet. There are some that now you can do both hands and feet. All of these are estimations because they are based off of a 2 or 3 component model of tissue. If you want something that might be considered a gold standard or more accurate, you might look into hydrostatic weighing, you might look into a bod pod, you might look into the DEXA. But again, I would tell you that those pieces of equipment, the DEXA compared to the other two, utilize information just a little bit differently, and so you have to read some research to make sure that you're using information appropriately for the population that you are in. Thank you for being involved with us today. Talk to you later.